Hello Instagram, it's Dr. T here, and we're going to talk a little bit today about what happens after the embryo transfer. This is obviously a really popular topic because we've had so many questions that have come through, and I might just wait a few moments till we get some friends jumping on. Thank you so much for joining us. Say hi, let me know where you're coming from. And if you do have any questions around like what happens after the embryo transfer, any burning, busting questions that you didn't quite get through, please don't hesitate to dump them in the chat. And if we get time, we will address them. Hello. Thank you so much for joining me. It's so good to have you guys on. I'm really grateful for you spending your Wednesday night with me. I'm going to tell you, it's been one crazy day. I don't know about you guys, but I am literally crawling towards the Easter break. So, yeah, all right, it's good. We got heaps of people on already. I know, thank you, Sammy Aston. I'm loving this too. This is a flannel number. I just thought I needed a little bit of bling for a Wednesday night. Sometimes you just gotta like get over hump day, and for me, it was putting on the bling skirt. So thank you. I love it too. Okay, so lots of questions. Now, what I want to remind everybody, I say this every week, but these are generic answers. If you have a specific situation, questions specifically pertaining to yourself, always go and seek some more advice, some more guidance, some more wisdom from your fertility specialist or doctor, whoever that may be. So the advice I'm giving tonight is general. It's as evidence-based as I can. Some of the answers, there is no evidence, and so it's probably a little bit of opinion. But let's get into it, shall we? Okay, so we're talking about what happens after the embryo transfer. So this might be you might not be there yet, you might have had several of these. Oh, I love the question, Wifey Hodges. That one's definitely on the list. It's been asked by several questions, so I'll definitely be addressing that one. But you've just pulled your pants back on. You've had a truckload of people in the embryo transfer room, and you've got these burning questions to ask. So hopefully we will address many of the questions and queries that you have. Somebody has asked the question, is it normal to have a bleed in week 6 to 7 in pregnancy due to IVF? The overwhelming answer to that is no. No, it is not normal, even in an IVF pregnancy, to be having bleeding in that first trimester. So bleeding in the first trimester is, particularly around week 6 or 7, is not a normal thing to be experiencing. So if you are experiencing that, I would definitely be tapping in with your doctor about that one. What foods are best after a transfer? Oh, I love this. Because isn't it amazing, right? You've done all of this work. You've had the injections, you've taken the pessaries, you put them in all sorts of places. Some of you might have been having progesterone injections. You've been having the blood test. You've been doing everything that your doctors and nurses have been telling you. The embryo goes back in and it's like, see you in 2 weeks. I actually think that after the embryo transfer is the most stressful time. I don't know about you guys, like give me some loving here if you think that 2 week period between the embryo transfer and the day you get your pregnancy test is the most daunting time, because for the first time you're actually like, I don't have to do anything. I might have to take my pessaries or my injections, but like, what can I do? Yep, I'm seeing the loving coming through. It's a really stressful and anxiety-provoking time. And it is a time when I know you guys just want to do the best that you possibly can. So let's explore some of these things. So what foods are best after a transfer? There's not really any great science behind this, but I believe that you want to feed your temple in the best way possible. So you're probably not going to be chowing down on Maccas and sucking back the Coca-Cola and, you know, heading out for lots of processed foods. But that's my opinion for anything to do with health and well-being. So there is no hard and fast rules or guidelines or evidence around what foods are going to give you the best outcome. That's the reality. It's just not an area that is easy to research. So I just think feed your body as best as you can. Whole foods is the way to go. Lots of fruits and vegetables. You guys know that we want you to be getting the protein and the fluids in, particularly water. We want you to be nourishing your body. We definitely want you to be taking your folic acid supplement. But as far as foods go, stay away from the alcohol. I think that's a no-brainer for everybody. Think of foods that are going to nourish your body and give you all of those important nutrients for not any cell rejuvenation, but to just grow a human being. I think be sensible about that. But there isn't actually any hard and fast evidence to show that any particular dietary habits. Now, perhaps if you are someone who's glucose intolerant, perhaps you're on metformin, perhaps you've got a bit of insulin resistance associated with your PCOS, probably wouldn't be chowing down on the high sugar foods. But again, I'd be telling you that whether you were having an embryo transfer or not. All right, so hopefully that is helpful in helping you choose. Miss Lizzie's asked about frozen PGS versus fresh. Okay, we'll come back to frozen versus fresh in a second. So I've got to clock these away. So if I don't remember, remind me. Are there any do-nots after an embryo transfer? And this person, I think I know who it is, has said, I promise no running. Okay, all right. I love this question. Here is the rules. Don't drink. Don't smoke. Don't do 10 CrossFit classes a week. Don't sit in a sauna or a spa and overheat your body. Now is not the time to be doing anything radical in your life. Don't be aiming to lose weight. Don't be, aiming to get fit in this 2 weeks post-transfer. Don't be aiming to detox in this 2 weeks. Live your life normally. If you are a fit and healthy woman who is used to doing regular exercise, then it's reasonable to be continuing to exercise. Now, to those of you who are addicted to their CrossFit sessions, their F45s, and their spin classes, this is not the time to be maintaining your peak fitness. This is the time to be treating your body as if it's about to grow a human being. Like, you need to reserve some energy. You need to decrease the oxidative stress. So I know this might sound a little bit patronizing, but you want to be doing the sort of exercise that you're probably going to be doing when you're 9 months pregnant about to give birth. And that's probably going to be more like gentle walks along the beach, perhaps a little bit of huff and buff. Hey, Chloe, high five. It's the sort of exercise that you want to promote some mindfulness, to promote some relaxation, make you feel like you've rejuvenated your body, but not make you feel like, you've just gone 10 rounds with Muhammad Ali. And that's just sensible, guys. So I was once told by my fertility specialist that this is a really short time in your life. And anything that you want to do with regards to your fitness and, your detoxing and eating organically and all those sorts of things can always be done again later. But we don't need to be doing those radical changes in this 2 week period of time. Just live moderately, apart from don't drink, don't smoke. And make sure you're on your folic acid. Okay, is it okay not to feel any symptoms? I'm presuming you mean pregnancy symptoms until later on. Yeah, everybody experiences the early stages of pregnancy very differently, and different pregnancies for women can also be really different. So it is normal to feel everything from nausea and vomiting, fatigue, breast tenderness, just feeling bloated, right through to feeling really energized as well. So the things that we do get concerned about is if a person has felt a certain way, let's say they felt fatigued, breast tenderness, and a bit nauseous, and then they lose those symptoms. So that's the sort of thing that kind of raises my bunny ears, but it is actually normal for women to feel fantastic and for some women to feel absolutely rubbish. So don't panic about the fact that you may not feel bad in the early stages of pregnancy. It's just if you feel changes that then disappear that we get a little concerned about. Okay, when an embryo is slow to re-expand, it's still collapsed at transfer. Does this translate to a low chance of implantation? This is a really hard question to be general about. But the the usual process is that an embryo will reach morulation and then blastulation, where they develop sort of that little fluid-filled sac, and you can often see a little inner cell mass on about day 5. And often what it'll do is it will expand, look beautiful, and then it will just collapse a little bit, and then it'll re-expand again, and then it will start to hatch. That is a very normal process. And ideally this happens at day 5. Sometimes it's a little slow and happens at day 6. We do know that pregnancy, so that's a normal process. So if you are getting an embryo transfer and your embryo might have collapsed a little bit, that can be the normal process of development. We do know that embryos that are a little bit slower to develop, so reach blastulation, the blastocyst appearance, by day 6. We do know that day 6s do a little less well on implantation and pregnancy rates than a day 5. However, it is still perfectly normal for an embryo to be transferred on day 6 and have a good pregnancy rate. Because often, unless an embryo is in the embryoscope, we're only checking that embryo once a day. So we might look at that embryo at the beginning of day 5 and go, oh, it's not quite there yet. Let's give it another day. But by the afternoon of day 5, it might have reached blastulation. And then we're not looking at it again until day 6. So just keep in mind that it is a normal process for it to collapse at transfer, but equally sometimes embryos behave a little slower, but they are still of transferable quality when they are at day 6. Okay, is there any evidence about perfumes in soap, body washes affecting implantation of the embryo? What you do in the months before transfer can negatively affect the process. I don't think we have any good quality evidence to show that if you're in the shower, giving your body a good old apricot body scrub in the weeks leading into an embryo transfer is going to affect your outcome at all. What I do know though is that when you come for your embryo transfer, don't give yourself a big spray of Chanel before you come in. We do know that there are volatile organic compounds that can get into the air that can affect eggs, sperm, and embryos. So you don't want to be sort of floating through a mist of perfume when you're coming in for your embryo transfer. Or we don't want your partner to be, dosing up on the cologne before he walks into the embryo transfer room. We certainly don't do it. So we know that those things can impact on those beautiful little cells that are trying to develop. So it's really important, I guess, on the day of transfer, not to be having lots of perfumes and lots of chemicals in the room where you're doing an embryo transfer. Yes, number 1, women's health, we do have embryoscopes at my clinic. Okay, what else? Following embryo transfer, what level of activity is acceptable? I love this exercise one. You guys all sound like you just want to go out and hit the F45s and CrossFit classes after your transfer. Look, I think the level of activity is, as I said, gentle cardiovascular if you are normally an exercising person. I wouldn't be exercising at 80-90% of your maximum heart rate. Or your perceived rate of exertion. As I said, it's a little bit patronizing, but gentle walks on the beach is a good idea. Entertaining some mindfulness if you have got rushing women's syndrome, like many people do, many women do. Really downgrading that adrenaline and cortisol. Now is not the time to be, entertaining, changing too much with your physical activity, but I think, think about where your current fitness level is. If you're someone who does moderate to high level physical activity every week, 3 to 4 times a week, then it's probably reasonable to continue to do that. But I would be limiting it to about that per week. Can you have sex? Oh, love the sexual intercourse question. Everybody asks me, can I have sex after I've had an embryo transfer? And I've got to be honest with you, I used to be of the opinion, no, it's going to potentially increase uterine contractility or infection, but in fact, that's been disproven in the research. In fact, there is some research that suggests that there's some chemicals within the semen that may actually promote implantation. So if you feel comfortable, if you're not too sore, bloated, from your fresh egg collection. And if you feel like you would like to have sexual intercourse, it's perfectly safe. You're not going to do any harm to your embryo. Your embryo is certainly not going to fall out. It's not going to reduce the rates of implantation and may, in fact, increase the chances of implantation. So, yeah. Oh, yes. You've asked about the breastfeeding. Why is it necessary? I'll come back to that one. Remind me if I haven't answered that at the end. What else? Frozen embryo transfer. How long is the process? Okay, so someone also asked the question, fresh versus frozen. The research says to us that fresh and frozen transfers are pretty much the same rates of success. However, it's important to understand that many women out there don't even get to a point where they can freeze embryos, or their embryos are not good enough quality to undergo the stress of being frozen and then thawed out. It's a stressful process for an embryo to be frozen, have all the fluid sucked out of it with chemicals, and then have all of that process reversed to thaw it out. So for some women, a frozen embryo transfer is just not even a possibility. But is your embryo as likely to have success if it is of freezable quality than doing it fresh? Well, yes. There is a school of thought, though, that a fresh IVF cycle gives you that really high supraphysiological level of estrogen that may actually expose the endometrium to much higher than expected levels of estrogen and might actually advance the endometrium. And in fact, the fact that the pregnancy rates at transfer for fresh and frozen are the same, despite the fact you're actually transferring your best embryo in your fresh and your less best in the frozen transfers. So there are clinics out there that only do frozen transfers. They do have what's called a freeze-all policy. Unfortunately, as I said, there are women out there whose embryos just don't survive the trauma of being frozen, even with a really good embryology lab. And so a frozen transfer is just not necessarily possible for every woman. There are different types of frozen transfers: a natural cycle, if someone's got a really normal cycle, an HRT cycle where we'll just give you the estrogen and progesterone, and also a low dose stimulation where we give you just a little stimulation to have you release 1 or 2 follicles to then give you the estrogen and progesterone to then support and grow the lining. There is now also, you will start to hear in your clinics wherever you are, that we can do personalized embryo transfers. So in that window of implantation that can be anywhere from around about day 6 to day 10 post ovulation, your specific time is kind of like a signature. You've got a genomic signature as to when your embryos should hit your endometrium in that window of implantation. And so there you will find that there are growing techniques to actually determine when exactly your personalized embryo transfer should occur. This is still very much at a research stage, though it is making its way into clinical practice. And if I have a couple who have transferred a number of what are thought to be good quality embryos without success, then I'll certainly consider whether or not a personalized transfer is appropriate. But whether you choose a natural cycle, a low-dose stimulation cycle, or an HRT cycle, in fact, in the research, pregnancy rates are kind of the same. So often it's up to you guys. And I certainly think it's worth discussing with your fertility specialist. Oh, the double embryo transfer question. My thoughts on PGS testing. PGTA is what we call it now. So pre-implantation genetic testing for abnormal number of chromosomes or in an embryo. What are my thoughts on it? I think it's appropriate in some patients. I don't think it's for everybody. I think that older populations, and I'm being generic and drawing the line at 40 for a woman, but I think that embryos that are probably a little challenged anyway from a metabolic perspective may not cope with the biopsy and the freezing and thawing process. So I'm not completely convinced that it's for everybody. Some states around Australia actually have rules where not everybody can access PGT. Like, for example, in Western Australia, there are only certain criteria for women under the age of 35 for you to be able to access PGT-A. So I could spend a whole night talking about pre-implantation genetic testing, but just in a nutshell, I don't think it's for everybody, but there are certainly populations where I think it's of value. Double embryo transfer. Okay, who do I think should get a double embryo transfer? I think it's important for everybody to understand that there are always risks when you do a double embryo transfer. The main risk is of a multiple pregnancy. Now, it sounds great. I'll just get twins and I'll get it all over and done with. That's what almost universally 100% of patients say to me. Just quickly, why would you bother doing the ERA? Because the ERA, I could go down the rabbit hole with this, but I think the ERA actually helps to determine a personalised transfer in women who've had multiple embryos put back. Anyway, now let's go to double embryo transfer, because a number of people have asked this question. You increase the risk of a multiple pregnancy, which increases the risks in a pregnancy of things like preeclampsia, gestational hypertension, preterm birth, babies going to the nursery, cerebral palsy rates, like I could go on. But the advantage to a double embryo transfer is that you do actually increase the pregnancy rates in that transfer. If you look at the research, you'll increase the rates of pregnancy in that transfer. But if you compared it to a woman who had subsequent transfers, so one, then another one, then another one, the cumulative pregnancy rates are exactly the same. So it's not an unreasonable discussion to have with your fertility specialist. In Australia, we have a single embryo transfer philosophy, and because of that, our aim is to get you a single live birth. But it's not an unreasonable discussion to have around double embryo transfer. Your intention is not to get twins. It's not to get your family over and done with, right? Your single embryo transfer. No, I think that you're right. The policy is that single embryo transfer is the recommendation, but there are certainly situations where double embryo transfer is open for discussion, but not without understanding the risks. What can a man do to help or feel part of the transfer process? What a wonderful question. Thank you to whoever asked this question, because I think it's a brilliant one. And I think that as a community, as a species, going through this fertility process as women, sometimes we forget that this is a couple process. And certainly fertility centres, I think, can do a lot more to ensure that men are involved. It's been so difficult over this pandemic time for many clinics who have had to limit the ability for people to come in to transfers. But it's really, really important for your partner, if it's a man, obviously, anyone, even if your partner's a woman, to come in for embryo transfers, because a pregnancy is a family thing, right? It's something that in most cases, unless you're going this road alone, a pregnancy is about the family. And it's really important for a man to be as involved as possible. So what can a man do to help feel part of the transfer process? Come. Definitely come along, be part, ask the questions, support. It's really, really important that men are made to feel like they're part of the transfer process and are there for the experience. Having the opportunity to see your embryo, having an opportunity to take photos of your embryo, have it explained to you, ask the questions. I think these things, men absolutely have to look after their health. You got it, 100%. Sperm is the most fantastic barometer of a bloke's health. And so looking after their general health and well-being, making sure they're not smoking, watching their weight, eating whole foods, getting a good supply of fruits and vegetables, all of those things are amazing and they're important for improving the chances of success. But to be involved in the transfer process and be part of it is an absolute right for a man. And I would want to know if a man was not feeling part of the process, what I could do to make that better. So if you guys have got any ideas about how fertility centres can do a better job at making partners feel part of the process, then gosh, share the love. Absolutely. What else? Gosh, there are lots of questions. Lots of questions. This is a really good one. Is it okay to get Botox or dye my hair prior to an embryo transfer? I don't think anyone would have done the research on that one. But what I do know is that in our environment, there are lots of things called endocrine disruptors. And there is a growing body of evidence to suggest that endocrine disruptors may impact on fertility. What are endocrine disruptors? They are chemicals that disrupt the hormonal signaling within our body. Plasticizers, so things that make plastic soft, which are ubiquitous in our environment, are endocrine disruptors. Hair dyes, there are components that are makeup. I don't know about the role of Botox, but I do know that the more endocrine disruptors that we have exposure to, there is a body of evidence that suggests that that may impact on fertility. So in a roundabout way, probably wouldn't go and get your roots done the day before you have your embryo transfer. Do I have any hard and fast evidence on that? No. But if you're looking to do things to help improve the process and there's things that you can take control of, then that may be one of them. But no, there is no great evidence to show that dyeing your hair prior to an egg retrieval or an embryo transfer is going to change the outcome. But I just wonder if it's just that the research hasn't been done as yet. Does assisted hatching improve the success of embryo transfers? I think we're fairly conclusive that no, it doesn't. The research shows that hatching an embryo does not improve its chance of implanting and improve the chances of pregnancy rates. So I think that we're fairly certain about that. Whew. I think I've come to the end of most of the questions about embryo transfers. I do, along the time, get asked about how we choose our embryos. There are various grading systems. The Gardner grading system is one of the most common that is utilised. And so that is something that people, embryologists will often use to choose embryos. You'll often get told about that, as I said, day 5, day 6s. And there is good evidence around different grading systems that are used within different laboratories. Often they'll get validated within the particular laboratory that you are at. So yes, I agree, assisted hatching is used for embryo testing, but it's not in its own right being shown to improve implantation rates. Cool. Thank you so much for joining. I'm so excited about all the questions. Did I miss any along the way? I'm really hoping that I didn't. There were some fantastic questions here. What I do want you to know is that when you are preparing for your embryo transfer, it's not the time to be making any radical changes to your life. Live an average, moderate life. Don't drink, don't smoke. Take your folic acid. Look after yourselves. I don't think you need to put yourself to bed. I don't think you need to wrap yourself in cotton wool. But take care of yourself. Do as little things to stress yourself out as possible. I wouldn't necessarily take heaps of time off work because I often think sometimes if you're just left to think, that can be as distressing as it is going to work. So look after yourself, take care of yourself, keep yourself busy, reach out to your nurses, your embryologists, your doctors if you have questions. Don't do your pregnancy test too early because it can be as stressful on you if the result is not what you're expecting. Follow the instructions, they're there for a reason. The breastfeeding question. Why is it important to stop breastfeeding before doing an embryo transfer? Because there are certain chemicals that your body is releasing when you're having a letdown and when you're breastfeeding that can impact on implantation. Particularly if you are having an embryo transfer and we're relying on your natural cycle, and the chemicals that are released when you are breastfeeding is actually working against your menstrual cycle. You would have heard of lactational amenorrhea. We have an evolutionary mechanism that when we are still breastfeeding our young, and this has been in place for thousands of years, that actually works against your menstrual cycle, your signaling to your ovaries, and subsequently your ovarian signaling to your endometrium. And we don't really want to be wasting or challenging those precious embryos in an environment that's not 100% conducive to implantation. And so I know it's such a hard thing to do, not breastfeed, or to wean when you know that, you know, your little one loves it and you love it, and it's that important bonding process. But I would really encourage you to stop breastfeeding, not even a sneaky nuzzle, because you know that all of those things stimulate the letdown process, and there are chemicals involved in that process that are going to impact on your ability for a cycle to appropriately stimulate the lining and therefore create a good receptive environment for your embryo. So I would not encourage utilizing an embryo when you are breastfeeding. I would encourage you to stop breastfeeding to give that embryo every possible chance that it should. It shouldn't matter if you are ovulating. It actually does. It actually does matter when, even when you're ovulating, because there is some hormonal disorder that happens even if you're ovulating. Day 3 versus day 5 embryo transfer. Yeah, I think the evidence is fairly conclusive for day 5. I could spend a whole night talking about this. The vast majority of clinics will advocate for a day 5 transfer. No worries. I'm glad you enjoy the answers. Absolutely, people get pregnant when they're breastfeeding. Of course they do. Well, they can get pregnant when they're breastfeeding, but their pregnancy rates are reduced. And remember, I'm not dealing with a normally fertile population. I'm dealing with those who have challenged fertility. So it would be my recommendation to stop. I have to go. Oh no, this is what happens when you open it up to random questions. Thank you so much for joining us. I would love to answer any individual questions. Remember, these are generic answers. Everyone's situation is slightly different. So I would strongly encourage that you go and speak to your fertility specialist, your doctor, and get all the answers that you need for your specific situation. Thank you for the love. Have a beautiful Easter. Have the most amazing Easter. I hope that life brings you everything that you ever desire. Have a beautiful week, and we'll see you next week. I think I might have a special guest for you next Wednesday night, so stay tuned. See you then.